If you're pregnant, this could save your life and your baby's life. Every week I see women who weren't sure if what they were feeling was normal or dangerous. And the truth is, most women are never clearly taught when to go to the emergency room. So I'm going to make this simple. There are three categories you need to understand. Emergency, go immediately. Urgent, call your doctor the same day. Or normal, you're uncomfortable, but it's not dangerous. Let's start with the emergencies. In terms of blood pressure and heart, if your blood pressure is this high in pregnancy, this is an emergency. A blood pressure of 160 over 110 or higher, or very low blood pressure, usually making you feel faint or dizzy. A heart rate below 50 or above 120. Chest pain. These can be signs of stroke, heart problems, or severe preeclampsia. Do not wait. Go to the emergency room immediately. Bleeding. Not all bleeding in pregnancy is dangerous, but this kind is. Heavy bleeding, soaking a pad in under 2 hours, or bleeding with severe abdominal pain. Bleeding after 20 weeks, even if painless. Bleeding with concerns about baby, and this can mean placental problems or miscarriage. Go to the emergency room. In terms of neurological issues, this type of headache in pregnancy is not normal. Severe persistent headache, vision changes, confusion, difficulty speaking, seizure, or the worst headache of your life. These may be signs of preeclampsia or even stroke. Get evaluated immediately. When talking about fetal movements, if your baby is moving less, don't ignore this. Less than 20 movements in 2 hours after 28 weeks, or a clear decrease from your baby's normal pattern, or even no movement at all. These can be an early warning sign that your baby is in distress. Get evaluated the same day or immediately. Other systems when talking about breathing or labor. These symptoms may not seem related, but they can be serious. Shortness of breath, regular painful contractions before 37 weeks, leakage of amniotic fluid, severe upper abdominal pain. These may signal preterm labor, infection, or preeclampsia complications. Go to the emergency room. There's also moderate urgency. In these cases, you should at least call your physician. In the first trimester, early pregnancy pain with bleeding, don't ignore it. Bleeding with abdominal or pelvic pain. History of an ectopic pregnancy with symptoms. Severe vomiting lasting more than 24 hours. Call your doctor the same day. In the second and third trimester, they may not be emergencies, but they still matter. Decreased movement that improves but feels off, or moderate bleeding without severe pain, a fever over 100.4 degrees Fahrenheit, persistent upper abdominal pain, severe abdominal tenderness. Call your provider the same day. When talking about gestational age, the context matters, and here's something most people don't realize. Timing in pregnancy changes everything. Before 24 weeks, evaluation depends on viability, meaning whether the baby can survive outside the womb. That usually doesn't happen until after 24 weeks or until the fetal weight is at least 500 grams. Between 24 to 34 weeks, the main focus is in preventing an early birth. Between 34 and 37 weeks, delivery may be considered. And after 37 weeks, labor signs matter more. You can have the same symptoms, but different urgency depending on the gestational age. So now talking about normal symptoms, these symptoms may feel scary but are usually normal. Heartburn, nausea early in pregnancy, round ligament pain, Braxton Hicks contractions, mild swelling, mild shortness of breath, increased discharge, back pain. These are common and expected. And when things that tend to confuse some of us, and this is where many women get misled, light spotting can be normal, Braxton Hicks contractions are not true labor, and babies have sleep cycles, but still, even a small amount of bleeding can still be dangerous. And no pain does not necessarily mean there are no risks. So if you're pregnant, save this video. You may need it later, and even if you're unsure, it's always better to get checked. Drop your questions in the comments, I'll turn them into the next videos. Thank you.